There's actually been a report out of the CDC about the fact that IMO is able to more rapidly predict outbreaks than the CDC is. And so we see there being opportunity around clinical surveillance with various public health organizations to leverage that data.
That's Ivana Naeymi-Rad, COO of IMO Health. And I'm Josh Nelson, Head of Healthcare at THL. And this is Healthcare in Action, a podcast that explores the latest developments and innovations transforming the U.S. healthcare sector, from cutting-edge technology to thoughtful approaches to patient care. I'm joined today by my colleague Jon Lange, who is going to lead us in a conversation about IMO Health, a clinical terminology software company, and how it is using the latest technology and AI to unlock the power of data in clinical records, and in the process, improving efficiency, cost, and outcomes across the U.S. healthcare system. Jon, take it away.
Thanks, Josh. Having accurate healthcare data is essential to the U.S. healthcare system. Diagnosis and procedure data is needed to provide high-quality care to patients. Claims data is needed to allow for reimbursement. And providers, payers, and patients are increasingly leveraging data to drive lower cost, better experience, and better outcomes. I recently had the chance to speak with Ivana Naeymi-Rad, the Chief Operating Officer of IMO Health, an HCIT company that plays a crucial role in the healthcare data ecosystem and has been at the forefront of improving data quality for health systems across the U.S. IMO Health was founded in 1994 when the founders saw the need for a common language to enable providers and payers to communicate with each other more efficiently. IMO's core offering includes a dictionary of clinical terminology, which is the standard used by most providers and EMRs in the U.S. It allows providers to document diagnoses and procedures using colloquial medical language without worrying about reimbursement codes, and it frees up providers to do what they do best so that they can focus less on administrative tasks and more on patient care. Recently, the company has been making a big push into data intelligence and analytics. Years of data from their terminology product has given them a unique glimpse into what providers are reporting and where. That data is in turn being interpreted via AI to provide better insights to clinicians. As the COO of IMO Health, Ivana has been at the forefront of leveraging data and AI to drive the healthcare system forward. Ivana has also been a thought leader in healthcare IT and a champion for building culture and driving diversity in tech. I spoke with Ivana about IMO Health, its mission to improve patient care, and the company's more recent focus on leveraging AI to drive greater efficiency and better outcomes. So let's get into it. Ivana, thank you so much for joining us today.
Of course. Thank you for having me.
First, for those who aren't familiar with IMO Health, would you mind just telling us a bit about the company?
Sure. So IMO Health has been around now for 3 decades. So this is actually our 30th year of being in business. And our mission started with really empowering providers at the point of care to navigate the transition from paper medical record to digital medical record. And for those of you in the healthcare industry, you'll know that the original electronic health records were really developed to help facilitate billings and less about empowering the provider or helping facilitate documentation for the provider. So let's say you come in for chest pain. The pull down may or may not have an appropriate representation of that term, but you're forced to select what's there. And those selections largely come from these billing code sets, which is really meant to be the language that helps insurance companies reimburse for that particular diagnosis. So it's not clinically friendly, let's put it that way. And so IMO really set out to ensure that when a doctor is sitting with a patient, that they're able to capture exactly what they want as it relates to that visit, as they did in the paper medical record. And so our key kind of foundational solution is a medical dictionary. So think of it just like you would any dictionary, which is a set of terms, and those terms have definitions. In our world, those definitions are mappings to different administrative and reporting code sets. And those are important in healthcare for a wide variety of reasons, 2 of the most important being billing and reporting further downstream. But really, that solution integrated into the core provider workflow allowed them to document without having to worry about all the downstream administrative process. And one of the things that we learned pretty quickly after implementing that solution was that there are still a wide plethora of data issues further downstream.
You spend so much time thinking about how to make providers' lives better and how to impact outcomes and experience for patients. Of course, we are all patients and consumers of the U.S. healthcare system ourselves. And so do you have any personal stories, friends or family, were you personally impacted by IMO Health?
Yeah, I mean, I have so many, but the one that always comes to mind for me was my sister-in-law. And this was 4 years ago. So she was pregnant with my nephew. And she was unfortunately diagnosed with stage 1 breast cancer. When they tested the tumor, they found that it was estrogen receptor positive, which is very important to understand because the treatment for that is different than it would be otherwise. And of course, just like all of us, but especially in that situation, she had a massive care team. Obviously, her oncologist, her obstetrician because she was pregnant, her family medicine doctor, she had a dermatologist, ophthalmologist, and she went to her dermatologist for a skin issue. And the great news was all of the data that was happening for her was being transferred to all of these different doctors. So it was up to date. But for this particular dermatologist, it was a different affiliated hospital than where the oncologist was from. And when the data was transferred over, the estrogen receptor positive part of that diagnosis was cut off because that EHR that it was sent to didn't have the ability to capture that level of specificity. So what ended up happening was the dermatologist prescribed her some medication that was estrogen impacting, which could have been extremely damaging to her treatment plan. And so the good news was we have some family members that are in medicine and were able to catch that quickly. But what it caused was, of course, chaos across her care team because they had to all talk to each other and figure out what went wrong. How did you not see this data point? Talking to the folks that had to manually input the data to understand why they didn't include that part of it. Oh, the EHR doesn't support it. And on top of it, of course, stress for her, just given such a sensitive time and potentially impacting her long term if she didn't have the right plan. So it just highlights, we were lucky that we had medical professionals in our family, but how often things like this are happening across our country and the importance of having the right data accessible to providers as quickly and as efficiently as possible to make the best decisions for their patients.
Yeah, and it's such a powerful story. We spend our time thinking about healthcare IT and data, and it's sort of easy to get lost in the nuances of it and the technicalities of it. And it's so easy to forget that this is impacting patients, and having the wrong data or having systems that don't talk to each other, that aren't interoperable, can really be dangerous, can lead to terrible outcomes. So it's a great example of how important the work you and your team are doing. One of the things I find so fascinating and powerful about your solutions is that not only are you addressing physician burnout and other things like cost across the U.S. health system, but also quality and outcomes. How do IMO's solutions impact patient experience, quality, outcomes for patients?
So one of the key values, other than, of course, the provider efficiency that I mentioned, is the fact that when you capture data that is specific and granular and in the terms that the clinician wants to capture that data in, it facilitates a more accurate clinical representation of that patient. Everyone has more than one provider that they're working with. And so when you're sharing data across your care team, you want to ensure that they're all speaking the same language and that they're able to see that this patient has this particular complication on top of this chronic disease versus just knowing that they have this chronic disease without that extra layer of identification or specification. So the outcomes are that much better because the appropriate diagnoses, the appropriate representation of that patient is captured at the point of care. So that's at the provider care team level. When you think about broader population health and how you want to look across very specific cohorts of patients to understand how they're responding to a medication or how a particular disease evolves given certain protocols, you want to ensure that you're appropriately representing that cohort. And the best way to do that is leveraging the language that the doctor actually intended so that you know that that patient is exactly the type of patient that you're looking for. Of course, there's financial outcomes that are improved through IMO as well, because the more specific and granular a diagnosis or a procedure is leveraged, the better the reimbursement will be as well. But of course, patient health and safety outcomes are much more important to us as an organization.
With so many customers using IMO's solutions, are there any insights you can draw from all of their behavior, the data, the diagnoses, procedures coming through the system?
Yes, actually. And this is one of the things that drew me to the company initially, because we're able in real time to see what providers are searching for at the point of care. So really, if you think about, COVID, you think about the Zika virus, you think about these kind of rare infectious diseases that are popping up, IMO can predict when there are outbreaks around the country in real time. And there's actually been a report out of the CDC about the fact that IMO is able to more rapidly predict outbreaks than the CDC is. And so we see there being opportunity around clinical surveillance with various public health organizations to leverage that data. The other use case is in life sciences. When they're looking for clinical trial eligibility, and that example of we were only able to find 5 patients with this rare disease in 5 years, looking at our data for that use case, we were able to find a few hundred in minutes. And so it's really interesting to see how we can leverage that data, one, to make our products better, which we do all the time, but two, to think about new use cases that really help enable the broader healthcare ecosystem.
Maybe switching gears a little bit, we are seeing lots of investments in automation, in AI. Can you talk about some of the investments you're making, some of the trends you're seeing, and then maybe that's a good segue to talk about some of your insights products?
So I think AI is kind of the key word that so many people are talking about right now. And what's important to note is that we've been leveraging AI now for over 2 decades. Not generative AI, but we're using machine learning, we're using deep learning. There are a number of natural language processing solutions that we've developed over the years. And what's really exciting about where AI is going is the compute power that enables us to build some of these GPTs, these large language models, and really process our understanding of language in ways that we just weren't able to before. In healthcare, and probably like some of the other kind of high risk industries, you can't return a response that isn't nearly 100% accurate. The quality is first and foremost the most important thing that's needed with any of our products. And we promise that to our customers. So we've created an AI layer that helps do things around our portfolio that helps us get to the answer more quickly, but still leverages the knowledge and the team to ensure that it's the right answer.
And, one thing you mentioned, again, it may seem like sort of a nuance or a footnote to some people who aren't in this every day, but AI is not 100% accurate. How do you manage that in healthcare when accuracy, when specificity is so important? How do you think about incorporating AI into all the various use cases?
So the way that we started, especially with the generative AI solutions that we've been developing, is first by understanding the foundation models. And there are a lot of them. So think ChatGPT, Google has their own, AWS, Anthropic, Claude. There's a number of these foundational models out there, and understanding which one provided the best results just out of the box for some of our use cases. Then we leverage our knowledge and prompt it accordingly. So when I think about large language models, one is the foundation model is trained off of a data set. So it's important to understand that data set that foundation model is trained off of. The second is prompting. And prompting itself is a whole classification set of frameworks on its own. And then third is knowledge. So the rules behind what is the expected output based on a set of kind of taxonomies or data sets. We play in that knowledge space very well as in the prompting space. And so we are looking at all these different combinations of how do we integrate both into a wide variety of foundational models to get the best, most trustworthy responses. And it's just important to ensure that you're constantly looking at how things are evolving and how your data and your prompting plays into the way that these large language models are evolving.
Got it. And there's so many key pieces of what you just said. One of them, maybe for a layman, is the importance of training a model. That generative AI models are so powerful. At the same time, they're only as correct, only as helpful as the data they're trained on. And IMO Health, of course, is a major player in the foundational data that the healthcare system needs. Is that a fair way to summarize it?
That's right. You have to rely on some set of knowledge to help understand, to some degree, the art of medicine. There is a science, of course, but there is an art to it that helps you really get into the mind of how a clinician thinks, how they document, how they look at a set of data inputs and decide on an output. And that's that knowledge that I'm talking about, that you can't get without kind of amassing the asset that we've built over the last 3 decades.
And maybe finally, I am a real optimist about the impact IMO Health can have on the whole U.S. healthcare system. As you think about what you and your team are working on now, what are you most excited about that IMO Health can bring to the industry in the next, call it 5, 10, 20 years?
I see us playing a major role in the understanding of data throughout the entire healthcare ecosystem. We're already starting down that path, and I see that expanding and the interest in us playing a big role in that expanding. And through doing that, I see us helping enable the ability to apply some of these advanced, powerful technologies. So this is an opportunity to accelerate those insights and really to kind of make possible that vision of every patient is unique. Every one of us has a unique fingerprint. How can we ensure that all of us get the best care possible to live the most healthy lives we can? And I see IMO playing a huge role in enabling that.
It's great to hear. Ivana, thank you so much for taking the time with us today. It's always a pleasure. Really appreciate it.
Of course. Thank you.
Thank you for listening to Healthcare in Action, brought to you by THL. To help Healthcare in Action reach more listeners like you, either share this episode with a colleague, subscribe to the show, or rate and review us on Apple Podcasts. For more information on THL's healthcare franchise, visit thl.com/verticals/healthcare.